I'm Tim Dreher. The following exercises are good for people who have either general low back pain, or they're especially good if you have arthritis or spinal stenosis. You were told that you have arthritis or stenosis either by your doctor or your physical therapist, and that was either because of an X-ray or MRI, but more importantly it was because of certain things that you do through the day. For instance, if you have stenosis, you're the kind of person that can sit or lie down and have absolutely no pain, but once you stand too long or walk for too long, you start to get a back pain. However, if you were to sit down, your pain would go away immediately. These exercises can also be somewhat helpful for a person who has a herniated disc, but there's a few changes that need to be made, which we'll go over. So now let me show you how to do the exercises to get rid of low back pain. This exercise program is called Williams Flexion. Again, it's best for arthritis, spinal stenosis, or general back pain. First, we take one knee and bring it into the chest. We go to the point of a stretch and then just hold that stretch. We hold for 30 seconds or about 5 deep breaths. A breath cycle being in for 2 seconds, pause, and out for 4. And then we switch sides, bringing one leg up, breathe in for 2, pause, and breathe out for 4. We go through 5 breath cycles, or the equivalent of 30 seconds. That was one knee to chest, and you can do one leg or 2 times on each leg. Our next will be the hamstring. We'll pull the knee into the chest again, and then bring the leg up to extension, and then to get a little stretch. So you are stretching the hamstring and the calf at the same time. Calf flexibility is very good for balance, by the way. Now if you want to add more strength, we'll go to the other side. I also teach Pilates, and in the Pilates world we actually take away the hands, so you have to use your quad muscles to hold the leg up in the air, so you're actually getting strengthening of your quads as you do this. And then switching again, if you have, however, had a disc problem, you would put the opposite leg down straight and only have the one leg coming up. With a disc, you want to make sure that the back stays in extension. It doesn't round and curl forward. So that's the hamstring stretch. The next one is the piriformis, where we put one ankle on the opposite knee, and then take one leg and just gently draw it up. And you can bring this knee to the opposite shoulder and hold for 30. You can also experiment with bringing it to the same shoulder, and that might give you a different stretch. And if you have great flexibility and no discomfort with this, you can actually bring the other leg as well, so that now both legs come up in the air and get a stretch there. Ooh, that's as far as that one's going? Yeah. And then switch legs. Ankle on the knee, and then draw the leg up towards you. And again, you can use the hands to guide the knee to the opposite shoulder, the same sided shoulder, or even bringing both legs up at once. This would not be good for a disc. Bringing the legs back down, we now do the trunk twister, where we take both knees and bring them over to the side. And if you feel like there's too much tightness as you do that, you could instead add a pillow, because our goal is that your leg can completely relax into the pillow and be completely unweighted. And now you can begin to stretch. After 30 seconds, we can switch sides. And to get even more of a stretch, we can take the right arm and bring it up over the side, and that will give you a stretch through the ribs, stretching quadratus lumborum, the rib cage, and then back up. The next exercise is just the pelvic tilt, and that's where you roll your pelvis in and flatten your back. We come up, hold for a second, and return. Doing that 10 times is a good way just to loosen up in the morning. Again, this is not good for a disc, this one specifically. And it's just a rolling, the belly curls in, the back flattens, and we try to keep breathing as you do it. And there's number 9 and number 10. Our next exercise is ironing the sacrum. We bring both your knees into your chest, hold the hands on top of your knees, and either hold and stretch, or some people like to rock their knees side to side to loosen up their low back. This is especially good for stenosis. And then one leg down at a time. Our next stretch is done on the side, rolling onto your right side. We're going to take this top leg, bring it back and down, let it rest on the bed. This is to stretch tensor fasciae lata, which is very good for people with either hip bursitis or knee pain. And then the arm will come up and over, and that stretches the armpit, the rib cage, the muscle in here that attaches into your low back that causes a lot of pain, and then all the way down the leg. If you are somebody who has lost height over the years, maybe you started at 5'6" and now you're only 5'3", you probably have lost it in this area. This is a good way to stretch this area and open it back up. And then we switch sides. And with the breathing, you're thinking breathe in, importantly breathe out for 4 seconds, and on your exhales when you want the muscle to soften and to let go. The more relaxed you are, the easier it is to stretch. It's a mild stretch feeling, and at the end of 20 seconds, the stretch feeling should go away. If it doesn't, it means that you've probably been overstretching and you could actually hurt yourself. So make sure that you don't feel the stretch after 20 seconds. And then our last one is the psoas, which is probably the most important. We'll do it first on the very end of the bed. So you just come to your bed, sit on the very, very edge of the bed, and you'll have both knees up in your chest to start. Lying back down. We'll hold one knee and drop the other off the edge. And your goal is that this leg is straight, and then the heel comes under and can get to about 90 degrees. Any less than that, you're going to have problems with your psoas, which is a huge muscle that goes from your thigh all the way up through the pelvis and attaches in your low back. When it's tight, or if one side is tighter than another, it can really throw things off and hurt you. We'll switch sides. Women who have sacroiliac problems will most likely find one side tighter than another. And this is a cue we want to talk to a physical therapist about what's going on. If it's difficult to do it on the end of the bed, we instead can do it on the side of the bed. So your shoulders are up on the bed, one leg is bent up, the other one is bent down, and it's the same exercise but just in an easier way to do it. Once you've identified which muscles are tight, tell your physical therapist, because then we can start to massage. The ideal sequence is to first heat the area with either a shower, a heating pad, or even just walking around for 10 minutes to stretch the muscles, and then have somebody massage out all the knots that just won't go away on their own, which is where physical therapy comes in. And then you go back through and stretch again, and then we go strengthen the muscles, and lastly finish with ice. That sequence is the best way to get rid of the muscle spasms. That's the myofascial release technique. If you have any questions, feel free to give us a call. We'd be more than happy to take a look at things for you. Thank you very much and good luck.